Good evening, everyone. So today's topic is past FRCR to be final exam and confused what to do next. So this topic is jointly conducted by FRCR Vivacity team and Doctors Relocate team. So in FRCR Vivacity is owned by two of us, Dr. Bharat Swami. You can see him in the picture, and myself, Dr. Vaiibhav Nichatt on the left side. And we have a representative from Doctors Relocate company, Mr. Jack James. He has more than 10 years of experience, and he has relocated almost 50 plus radiologists in past 3 years. So I'll give brief introduction about.
Sorry.
I'll give brief introduction about first FRCR Vivacity team. So what is FRCR Vivacity? So Dr. Bharat and I, one day we decided that there are hardly any resources for Viva, particularly for Viva, and there are many other companies in the market who are providing Viva for those sessions are costly. So we thought we'll start this company, FRCR Vivacity, and it is almost more than 2 months now. We are regularly conducting the sessions of Viva. We recruit almost two radiologists exam-going FRCR aspirants, and we ask them one-on-one questions. We give them 4 to 5 cases, 6 or sometimes almost 6 cases. We do this every Friday 9 p.m. Indian Standard Time. So the basic goal and aim of FRCR Vivacity team is to help FRCR aspirants to pass the exam with minimal efforts and maximum efficiency. Obviously, not neglecting the hard work. Okay, and since now the results have just now have been declared by RCR examination couple of days back, we want to congratulate each one of you after passing the FRCR final examination. Thanks to all of you for joining the session on such a short notice, because I just gave it few days back that we'll be conducting the session. And I want to thank you, Mr. Jack, also for helping us in conducting the session on such a short notice. The past candidates, I can understand. We congratulate you. Each one of you are very happy, but we want to make sure that those who did not do well or did not pass the exam, did not clear the exam, FRCR Vivacity team is with you. We will help you. We'll regularly conduct the sessions, and we'll. It is our motto. It is our aim that you should pass the exam with minimal efforts and maximum efficiency. So in today's session, we are going to discuss what happens after you clear the FRCR examination. So each one of us has gone through and will obviously go through the same path. So when I passed the exam, I had many doubts like what to do after passing FRCR examination. That was the basic doubt, and there are hardly any resources available. So I asked a few of my seniors and my colleagues. So basically, we come to know what is happening in UK through our friends or through our seniors, right, who have been working over there, who have passed the exam in the past, and what is the detailed process, how this process works of GMC registration and getting relocated to UK and finding hospitals. What all documents do you need in order to register for GMC and for further process? There are very different steps, and today we have requested Mr. James from Doctors Relocate company to brief us regarding the process, what happens after you clear the FRCR examination. There were few doubts like what is EPIC verification, what does EPIC stand for, and when should one start the process of relocation or for GMC registration if one decides to shift to UK. So a brief introduction about Mr. Jack James. He is a senior consultant in Doctors Relocate company. So as the name goes, Doctors Relocate means they are in the business of relocating various medical professionals from all across the world to the UK. They help them so that the medical personnel they don't uh, get confused in the process or what is the next process. He himself, like I told before, he himself has more than 10 years of experience in his company, and his company actually, his company has in total more than 25 years of experience. So they are in the business, they are relocating doctors each and every year. So Mr. James is a very experienced, and the numbers, it is all the number game. So he has relocated more than 50 radiologists in past 3 years. So I think he is a very well experienced in the process, and he is going to brief us. One thing, I want to share this because when we just before the result declaration, Dr. Bharat and I, we were thinking like that we should help the students. Like we also had this doubt in our mind that what one should do after they clear the FRCR exam. So I contacted many relocating companies. So Mr. Jack James, he was the first one to respond. Means I dropped him the message and he called me within seconds. So so this is how good is he as a human being. And then within seconds, when he called me, we discussed this, that what is the agenda of the meeting, what these people are going to, what our viewers are needing, what is their need, and what are their problems, what should they do next after clearing the FRCR examination. So in such a short notice, I guess we talked to him less than a week before the exam results by the RCR examination. And on such a short notice, Mr. Jack, he prepared his PPT in such a short span of time. And after that, we spread the message. And here we are. Today, we are conducting the session. So, in short, he's a very hardworking and dedicated person. He's a senior consultant of Doctors Relocate company. He's very experienced. So now I think I have spoken enough. I should stop. So I don't want to bore you with all my philosophy and everything. I want to hand over the mic to Dr. Bharat, who is my colleague and integral part of FRCR Vivacity team. Dr. Bharat, please go ahead. Over to you.
Thank you for the introduction, Dr. Vaiibhav. And firstly, I would like to welcome Mr. Jack James to our platform. And we are really glad to collaborate with him. And since he responded to us very swiftly and he got ready for a session in such a short time, I would like to thank him for this. And to all the participants, I am really thankful for your participation. And mostly this kind of question, it came to me as well when I passed my FRCR examination because even I was not completely aware about the procedures which are required to relocate. Before even thinking about relocating to another country, since I have no one in my family who has previously relocated or is a medical fraternity who is studying abroad, I have very few friends who have gone to UK. So I never had a clear picture. So this was whatever we do at Vivacity is predominantly the queries or the doubts which we had during just after our preparation or during our preparation. So this was one of the doubts which we had once we completed our FRCR, that what are the steps which are required. I don't think so. I am still not completely aware about all the steps. So this session is very informative for me as well, and I am also looking forward to it. About knowing about the to get a clarity about the picture and what steps we are supposed to take for the relocation. And we are glad to have Mr. Jack James over here. And at the end of the session, we'll be happy to have some questions. And if any question, even I would like to ask some questions. So without taking much time, I would like to welcome Mr. Jack James to please take over and take forward this meeting.
Yes, I firstly want to say thank you guys for both inviting me on to this webinar today. You know, it's a great pleasure to be able to present to you guys and the radiologists that you've got and assisted over the last, you know, few months that have recently passed the FRCR exams or even still in the process of doing the exams. So yeah, I created a presentation which I can share on the screen. I'm just going to step that up now. Bear with me 1 second. Bear with me. Sorry, bear with me.
No problem.
Are either of you able to share the presentation I sent you, because it won't let me do it on my computer? Sorry.
You're not able to open your presentation.
It won't let me share my screen for some. Oh, here we go. I've got it. Don't worry.
Yeah,
I've got it. Let me put that in. So can you see the presentation now?
Not right now. Can you share your screen, please?
It's visible to me.
Can you see it? Can everybody...
Yes. Now we can see. Your voice is audible. Please go ahead.
Perfect. So yes, so today obviously the outcome here is to give you all an understanding of, you know, the GMC registration process, securing a position in the NHS, relocating to the UK, and then obviously at the end we can go through any questions that you've got. If anybody does have questions moving through the call, you can ask at any point, as I'm happy to clear it up there and then. So yeah, I think Doctors Relocate have already had a really good introduction from you both, and you know, we specialise in assisting doctors from overseas obtain GMC position in the UK and the entirety of the relocation process. Now, me specifically, I manage and head up the radiology division. We do have other divisions in general medicine and psychiatry and in every other specialty, but for me, I solely do radiology. So I live and breathe radiology and assisting doctors take that step over to the UK. You can see on the screen there's a couple of reviews that I have been personally left over the last few years. We had a Dr. Shrivastava and a Dr. El Maraghi, both sort of, you know, give me really good feedback, and that's just two of many reviews that we've had. So yeah, that's a brief introduction as to what we do as a business. So the General Medical Council is, obviously you probably all know, is the medical council within the UK, and that's what you are required to have to work as a doctor. Now, there are steps that you need to follow to get your GMC registration. The main thing you need to do, which will take some time, is there's one or two things. So the FRCR certificate and your primary medical certificate both need to be verified by EPIC. Now, EPIC is a verification system that the GMC use to prove that the certificate is what you say it is. So you have to create an account with EPIC. Now, that sometimes is quite an easy process, actually. You simply just input your details. You have to do a thing called a notary cam, which is basically where you show your ID on a video call with the EPIC team to prove that you are the person you say you are. And then you have to submit your FRCR certificate and primary medical certificate as well to EPIC. What happens, we do find in some instances that the FRCR certificate is verified pretty quickly within a week. Sometimes the primary medical degree does take slightly longer. And if you're in India, which I think predominantly most of the doctors on the call today are, you will find that the college that you've done the degree in India sometimes will charge a small fee for them to verify it. So just check when you're submitting that with your college that you've done the degree at, that whether or not you need to pay a fee, because we've had doctors previously, when we first started out, they would submit their primary medical degree and it would sit on Epic for a week, 2 weeks, 3 weeks, and nothing would happen. And then we found out, a few years ago now, that some of them in India, you do have to pay them a fee. So make sure you do that. The other things you need to do is prove your identity. That will be with your passport, driving license, and similar documents. And then you have the evidence of the English language proficiency. So there are 2 exams, and I believe that's on the next page. There are 2 exams. Now there's the OET, which is the occupational English test, and then there's the IELTS, which is the International English Language Testing System. What my personal advice is 90% of the time is to do an OET. The OET is occupational based. So the exam is specifically catered for language what healthcare professionals use daily. So it will be language that you're familiar with and wording that you're familiar with. And sometimes it's not, I wouldn't say it's an easier test, but it can be, seen as an easier test because it's something you're familiar with. Whereas the IELTS, it's more generic English. You do have to make sure that you're doing the doctor's part of the IELTS, but it's still very generic on the English test. The flip side, so, the thing with the OET is that the exams are not as frequent as IELTS. So you might be able to get an IELTS exam within a week, whereas the OET, you may wait a month. So there are benefits to both, but, I would always pretty much advise doing the OET. If you're up against it with time and, you want to get to the UK really quickly and you're comfortable doing it, then the IELTS is the quicker option typically. So yeah, that's a brief overview of both exams. Once you've passed these exams, you will also be able to submit that to the GMC. One thing I didn't mention, on the GMC side of things, you also have to provide them with a certificate of good standing from anywhere you've held a medical license in the last 5 years. So I know in India, each region, you hold a different license. So if you've been in one part of India and worked and been in another part of India and worked as a doctor in both regions, if you've worked in both regions in the last 5 years, you will need a certificate of good standing from the medical council in both regions. Other countries, it's very different. If you're in the Middle East, you've only worked in one country, then that's fine. But in India, I know it's regionalized. So just make sure that you've got that. Sometimes that can take a little bit of time to get. So I would advise, if you're in the process of doing the GMC now, get that done as soon as possible. Once you've got all them documents ready to go, you submit them on the GMC website. Now it's really easy to create a GMC account. You literally go on the GMC website, and in the top right corner it says GMC online, and you complete an application form. The fees for your first GMC registration, it's around £400 British, and then there's an annual fee as well. But that's something you can deal with in the future. I don't know if anyone initially has any questions regarding the FRCR, the GMC, or the EPIC. I don't know if anybody's got any questions before I move on.
Just wanted to ask regarding the OET, what is the score needed? Means for IELTS, I know that we need 8777 score.
Yeah, so in the OET, you need a B across the board. So there are four different sections, which is reading, listening, writing, and speaking, and you need a B in all sections. So yeah, that's what you need on that.
Thank you.
I have another question. GMC registration. Is there any time frame within which we are supposed to compulsory get GMC registered after clearing our FRCR examination?
No, I've had doctors in the past that passed their FRCR 10 years ago, and then they've done their GMC, because there are some doctors, and maybe some doctors on the call today, that are not quite ready to relocate to the UK because of family reasons or work commitments, or you're just you're not confident enough or not happy to come to the UK yet, and it's not your time. But it doesn't matter when you do it. There's no time frame between the FRCR and the GMC registration process. No, the only thing that you have to be careful of is your English language exam. Both of them, whether you do OET or IELTS, will only be valid for 2 years. So if you sit that now and you don't get your GMC registration in them 2 years, then you'll need to do the English test again. Any further questions on the GMC at this stage, or?
We had a few questions in the chat. Maybe we'll take it at the end together.
Yeah. I mean, I'm happy to answer them questions at the end. Yeah, I've not seen them because of my screen sharing, but yeah, we can go over them questions at the end. Now, how we can assist you in your job search, we are not a business that is just, going to leave you in the lurch. We offer a rounded package and it's bespoke for everybody. Now, we get exclusive opportunities. We work with all NHS hospitals. So there are around 175 radiology departments across the UK, whether that be in England, Scotland, Ireland, and Wales. And the problem that the NHS has is that there's a shortage of radiologists. So some of the hospitals may not advertise jobs at the minute, even though that they've got requirements in their department for doctors to join them. And because of our extensive network of lead consultants and managers within the NHS, we're aware of positions that maybe you wouldn't be able to find if you was just looking online. But yeah, as I was saying, we have a tailored recruitment service that can cater for your needs. And the benefit of working with us is that it's customized, and we will be able to deliver you into the hospital exactly where you want to be. And we have a knowledgeable recruitment team. There's no stone that's unturned. There's no situation that comes up that we haven't seen in the past. So we're very experienced in helping doctors. And, there might be something that seems very daunting to you as a doctor, as you're not quite sure what to do. It's probably something we've seen a lot of times, and, we can help you. There's no problem in that. The other thing that we can offer here as well at Doctors Relocate is that we have comprehensive insights. We know the market, and you'll receive detailed and reliable insights on what's actually going on in the job market at the moment in the UK, because things change very quickly. There might be a hospital where 3 doctors decide they're going to retire, but we know the lead consultant in that department, and we've already got doctors like yourself ready to go into them positions. So yeah, we've got comprehensive insight across the whole of the board. The next thing that you need to do, though, is the CV. The CV is something that I can assist you with. We have a CV template, which I'm happy to provide anybody that wants to see it. We have it in the format that the lead consultants and the NHS typically want to see your CV. Clear and concise, with information that the lead consultants want to see. So we're happy to send that across to everybody. And if there's anything that we think needs adding to your CV or taking off, we can certainly let you know of that as well. Then once the CV's in our hands, we'll be out there arranging interviews for you. The things that you've got to bear in mind when you're looking at interviews, and you arranged a call with a couple of hospitals, you need to research the hospital, research where it is, research the department, how many consultants are there in the department. Now, this is all information I can provide you, but they're going to ask you questions that maybe that we don't expect them to ask always. But if you're prepared, you'll be able to answer them very easily. What we do find is when the hospitals do want to speak with you, say, for example, we've got a general radiologist and there's a general position in a hospital in the Midlands, they might, in some instances, just have an informal conversation with you initially. So it'll be just you, the lead consultant, and maybe one of the managers in the team. And it's a really informal chat, talk about what the department needs, and talk about what your experience is and what you can offer them. And if you both think it's a good match from there, they'll often do a formal interview where HR is on the call. Things are a little bit more formal. They may ask you a clinical scenario, and they may ask you more extensive questions, and it's something that we can prepare you for before the interview. We have resources that will be able to get you ready for an NHS formal interview. It may sound daunting, but we do this quite a lot, and a lot of the doctors that we work with the preparation we give them are usually successful. So, and then moving on from the interview, I'm just moving in a timeline of how things would go. So once you've had a couple of informal calls, you may have a few offers on the table. we'll be able to negotiate the employment offer for you, making sure that you've got the best possible terms. What we do find is that the main things that doctors from international locations are looking for is the most competitive salary and a relocation allowance. In regards to the salary, what we often find is that hospitals predominantly will take some of your overseas experience into consideration. So if you're employed as a locum consultant within the NHS, which is what you'll take, so you'll be employed as a consultant on a 1-year contract initially, in some instances 2 years. The salary is based as a consultant on the years of consultant experience that you have. Now that can vary though, because some hospitals only accept NHS consultant experience, some hospitals will accept international consultant level experience, and some of them will deem it maybe 50%. So if you've got 10 years of overseas experience, you might get all 10 years taken into consideration. In most instances, it will be 50%, which would put you on pay point 5, which I'm happy to share the salary scale with you as well after the call. But the salary, just to confirm, is between 93,000 and 126,000. But the 126,000 mark is once you've got around 20 years NHS experience. The other things that are obviously negotiated is the relocation package. Now, some hospitals will offer you this, some of them won't. We often find it's the hospitals that are in the less desirable locations. So if you're in London or Manchester and places like that, in Bristol, you may not get a relocation allowance because they don't need to offer it, because they have, an abundance of doctors that want to work there. But if you've got a hospital that's in a remote part of England or remote part of Scotland, they will, offer you a relocation allowance as a thing to, sort of soften the hit when you're joining them. So that's something that we always negotiate for you. And, we're here to get you the best possible package. So once you've got your offer and it's all accepted, we have a comprehensive relocation support system. So the pre-employment checks is something that every hospital has. A lot of them will ask for your immunization history, your GMC certificate, proof of your English language exam, references, ID, and that's most of the documents. Once you've passed all the pre-employment checks, the hospital will give you a certificate of sponsorship. Now, a certificate of sponsorship is what you take with you to your visa appointment, and you can't make a visa application without the certificate of sponsorship, which ultimately the document is basically saying that the hospital are happy to sponsor your visa, and it will have all of your details on there, full name, address, parents' names, everything to do with you will be on that COS. We always advise doctors to meticulously look through that, because if there are any errors, it can cause problems with your visa application. But rest assured, I'll be there to check it for you. You can check it. If you've got a partner, they can also check it. Make sure everything's in order. Once the visa's done, the visa application will cost around £400. And then from there, £400 to £500. From there, it will take, if you do a priority service, that's a little bit more expensive. That will take a week. But if you do the normal service, it will take 3 weeks for you to get your visa approved. Once that visa is approved, we'll be helping you make the travel arrangements to the UK. We do find a lot of doctors from India will fly to the Middle East, somewhere like Qatar or Dubai. It splits the journey in half pretty well, actually. It's around the sort of 6-hour flight and a 7-hour flight. So it splits it up, quite well. There are direct flights from the bigger cities in India into Heathrow, Birmingham and Manchester. It really depends on what route you want to take. We also have experience and help in a sense that when you arrive in the UK, you're going to need accommodation. Now, depending on where you are, the accommodation may cost a little bit more or a little bit less. Often the hospitals will have on-site accommodation, but the availability is also very limited in some instances. What we advise is to initially, we'll contact the accommodation team at the hospital that you're joining to see if there's availability. Now, what I would say, in 99% of cases, it's only single person accommodation. So if you've got a family, my advice is always to come alone for the initial 2 to 3 weeks. And in them 2 to 3 weeks, you stay in the single person on site accommodation. and then we will assist you in the rental search, because you can't rent a private rented property until you're in the UK, because you need your BRP card, which your BRP card is ultimately a card that proves you have a visa in the UK, which you collect when you first arrive from a local post office. Once you have that BRP card, you're enabled to then secure a private rented property, which is the reason why you need short-term accommodation initially, as you don't need it in that instance. Now, the rental process, if the property is empty, you can be moved in somewhere within a week to 2 weeks, depending on whether the property is already empty. But if it is, you can move in pretty quickly. The other things we help with is setting up a bank account, setting up a UK SIM card, childcare and schooling arrangements. We can help you find the right schools for your children. And if there's anything that comes up that you're maybe not expecting, then we're here to assist. There's nothing we haven't seen before. So yeah, that pretty much summarizes what we offer and how we can assist you doctors. If anybody's got questions, I think there's some in the chat. Please let me know.
Yeah, I would like to, there is one question in the chat. Yeah. Dr. Nisha wanted to ask, will you be able to relocate doctors for substantiative work and in preferred location in NHS trust?
Yes, so
specific priority.
yeah, of course. So to be a substantive in the UK, a substantive is a consultant on a permanent basis. To work as a consultant on a permanent basis, you have to be specialist registered with the GMC. To be specialist registered with the GMC within radiology, you need to do one of two things. One of them is to be trained in the UK, which most of you doctors obviously won't be. And the other thing you need to do is CSER, which that is something that you typically do once you arrive in the UK. But we are able to find you locum consultant positions, which the salary is the same as the doctors within the NHS. There's no difference except the fact that it's not a permanent contract, because legally they're not allowed to offer you a permanent contract as a consultant until CSER's done. We are, I did just see a question as well about helping with fellowships. It's something that we can do. What we do find, though, is that they're very, very competitive, and lots of doctors do apply for them. And that will be a lot of UK trained doctors that will be applying for fellowships. We often find that hospitals don't request us to provide them with doctors to take up a fellowship position. We do on a rare occasion have them come up, but they're a lot rarer than the locum consultant positions.
Any other person if wanted to ask anything, we'll keep the chat open. I had a few questions.
Yeah, of course, fire away.
Yeah. First thing I wanted to ask was, will the candidate will require to, will you be charging anything to the candidate for the relocation?
No, our service is completely free of charge for doctors. The hospital pays us. The hospital pays us, so that our service is free of charge to doctors. So there's no fee from us to you.
Okay. So in generally what we see is there are better positions and better charges to get a better job if you have done any fellowship in any subspecialty in your country or anywhere else. So do you suggest someone to do a fellowship in any particular subspecialty before application for any job in UK or relocation?
It really depends on what you want to do. If you've been doing general radiology since your residency, then we'll be able to find you a general radiology position in the UK. Now, you will find that, you know, sometimes if you're an interventional radiologist, maybe, or a breast radiologist, you might find doing a fellowship in India or even finding one in the UK might be beneficial for you, but, you know, it's not an absolute must.
Will this hamper in the amount of prospects or the salary which one may deduct if someone is not having any specific subspecialty fellowship?
No, the salary is based on years worked as a consultant. So if you've worked as 2 years as consultant, you should be put on to 0.2. Sometimes they'll put you on 0.1 because they don't see it as NHS experience, but every hospital has a slightly different policy. But your experience as a consultant is all that matters. It doesn't make any difference if you've done a fellowship or not.
In India, many radiologists they work in independent diagnostic centers as consultant radiologists. So that taken as a qualification within the experience? or
It,
it is supposed to be done at some dedicated hospital only. That
no,
will.
if you're working in a diagnostic center or if you're working in a tertiary center, as long as you're working independently, that work would be deemed consultant level.
But one will have to provide any documented proof for it.
Yeah, so to get the salary approved in the hospitals, you'll need to provide experience certificates. The experience certificate is something that most hospitals I've always found the hospitals are able to provide it to you. And it just confirms that, I think in India, the terminology is slightly different, but you'd be working as an associate professor or a professor. And it would confirm that you worked from X date to Y date as a assistant professor or professor in radiology, or consultant if you are working as a consultant.
On an average, what is the time duration we are looking at when one starts to apply? Suppose if I want to apply from today's date, including the GST registration, and what is the time duration I am looking at by the time I will get a suitable placement?
Yeah, I mean, it's really dependent on how motivated you are to get it done. That's what I would say. So it's, if you're motivated to get moving to the UK, it can be done a lot quicker. So what I mean by that is if you're ready to do your OET or IELTS, you've got it booked, you've got it done, and you're in the process of sorting all of EPIC, the GMC process, if you do it efficiently and you pass the OET or IELTS first time, shouldn't take really longer than 4 weeks, 4 or 5 weeks. And then from there, the hospitals we find will interview you once you've got your OET at least booked. Some of them won't offer you a job until you've got it, but they may be ready to offer a job once you've passed it. But what you will find is that you'll be able to be in the UK if you start your GMC today. Say it takes 1 month, which takes us to May. You should be able to get to the UK within 3 months of that. So it's around 4 months from now, roughly, is the quickest you'll possibly be able to do it.
Yeah.
I see a question regarding GPs. Yeah. So one thing I didn't cover earlier on. So when the hospital offers you a position and they give you a certificate of sponsorship, that will enable you to get a visa not only for yourself, but for your spouse and your children under the age of 18. So they'll get a dependent visa. If your spouse in that instance is a GP, now GP practices there are GPs in hospitals, but there are also private GP practices all over the counties and the towns. There's no shortage of work for GPs. So as long as you as a radiologist have got a visa, if your spouse has got a dependent visa, which you will have, there will be no shortage of work as a GP, as long as you've got GMC registration.
So Jack, they'll have to do some PLAB courses then to work as a GP, or they'll have to do some different courses? Yeah,
PLAB is the most advised to do for GP.
And for before moving to UK, PLAB 1 is sufficient, or the spouse, he has to clear, or he has to clear both the steps, PLAB 1 and PLAB 2?
You have to do both steps, because regardless of the radiologist's situation, the spouse also needs GMC registration. So to get GMC, you need to do both parts of PLAB. Does that make sense?
There was one more question, I think. So yeah, someone gave some specific. Yes.
Yes. So Dr. Rajesh's wife, who's a pediatrician. There is, like there is in radiology, there's also a shortage of pediatricians in the UK. Now, she will need to complete the MRC PCH to get her GMC registration. And what you'll find is that, if you've secured a job as a consultant radiologist in a hospital, they will 90% of the time be able to accommodate your spouse or your wife as a pediatrician in this instance. Now, I'm not a specialist in pediatrics, so I don't know what level of jobs you can get. I know that often from experience in the past, I think if you've worked as a consultant overseas, they may not employ you as a consultant in the NHS. You may work at a middle grade, which is specialty doctor or specialist. But as I say, I'm not a specialist in that area. I know that there's a huge demand for pediatrics doctors, though.
Okay. Any more questions you would like to take from the candidates? If anyone has any other questions? Okay. Dr. Vaibhav, you would like
Yeah.
to ask anything?
Yes. Thank you, Dr. Bharat. I know you are not feeling well. Still you contributed. You volunteered to do this. Jack, I had some questions. Like you told me, like you told us that you will provide a CV template and salary scale. Would
Yeah.
you be sending it to me so that I'll forward it to all the radiologists in our group, and
Yeah,
so
I'm
that
happy to
it
get that
will be
done. Yeah,
beneficial?
I can
Yeah.
send everything over to you. Yeah.
Yes.
If any doctor has any questions, then they can get in touch with me via email or contact number. I think I'm also in the Telegram group, so just to at
Yes.
me,
Yes.
you can at me in the chat, and I'm happy. I'll be of assistance at any time. If I don't reply instantly, I'll certainly reply within a few hours.
Yeah. So I also have few questions, Jack. Like there is some I don't know, there is some confusion regarding the time period. Means once you clear FRCR, many people believe that it will be good for the student if he or she moves within 3 years after completing FRCR. So what happens if the student doesn't move within 3 years? What happens at fourth year, fifth year? Do they going to do any detailed checkup or any detailed investigation, or are they going to ask us to write something else, some exam, or do they take any academic interview before doing all this?
No, from my experience, it doesn't matter. I think I said at the start of the call, you could have passed your FRCR in 2010 and decided that you want to relocate now. So you've started the GMC process. It doesn't matter when you do it. Everybody's situation is different. You may have done FRCR to relocate straight away. You may have done FRCR to, put it on your CV, and it's a great achievement, but you're not quite ready to come to the UK, and there's no problem in that, and you can do your GMC registration at any point.
Okay. The other question I had is regarding the means after moving to UK, you said the minimum duration of work we'll get is 1 year. I wanted to ask, can we apply for 6 months or less than a year, so that instead of working at only one place for one whole year, can the student work for six months at two places, so that the experience will also increase?
You can do that. I wouldn't say that's necessarily beneficial in doing that.
Okay.
If you're working at a big tertiary center, there's no reason why you should move on after the first 6 months. The other thing that there's the implication of additional visa costs, and most of the hospitals that we work with will want you for a minimum of a year. You can leave. You have a 3-month notice period, so you can leave technically. But my advice is to at least do 1 year in that first hospital.
So if the radiologist leaves by giving 3 months notice period before completing a year, then also you'll be able to help him or her to find a different job in some different city or different province.
Yeah, we've had a lot of doctors in the past that have taken a position. If you're just doing general radiology at the moment and there's no subspecialty interest that you currently are doing actively, and you relocate to the UK as a general radiologist, sometimes you might find that you take a position in a district general hospital just to get your foot through the door of the NHS. Once you've got 1 year's experience, it's very easy for us to find you a position in a bigger tertiary centre. What we often find is that's the case. Doctors might come here and they'll go to somewhere that's not quite a desirable location, and then they'll move on after a year to somewhere that suits them a little bit better.
And people also say that it is difficult to find a job in central part of the London, and it is easier if you go a little bit periphery. So what happens means tomorrow if I decide to shift to UK, and definitely in the central part of the London you will get less pay, and there are hardly any job opportunities. And if I go to peripheral part of UK, if I work over there for 2 to 3 years, and then after 2 to 3 years, if I decide, if I and my spouse also decides that no, we have done enough right now, we have to move to the central part, so that it is easier to get access. Some people like the lifestyle of central London instead of working at the periphery.
Yeah.
So what happens in that case?
Yeah, what you'll find is this: the central London hospitals, King's, St George's, Guy's and St Thomas, predominantly they have a good background of UK trainees. So they don't necessarily need to appoint international doctors in them big tertiary centres in central London. Once you've been here for 3 or 4 years, if you wish to go and work in London in one of the bigger hospitals, you'll be in a much better position to be able to secure a position in one of them hospitals because you've got a wealth of UK experience. Whereas, coming as your first job in the NHS when you've not worked here or trained here, sometimes to get a job in London will be, a little bit more difficult than the rest of the country.
Okay, so what are the chances if I directly want to shift to the central part of the London? Then what are my chances of getting job in the central part of the London instead of if I don't like my life in the peripheral part of UK? So what if I decide to go to the central part and I'll work only in the central part of the London and not somewhere else?
Yeah, I mean, the trouble you have is that there's, in central London, there's about 5 or 6 hospitals, which I obviously named a few. The departments will have different needs at different times. So, once you've got NHS experience of 3 or 4 years and you've completed CSER, there's no reason why you can't get a job in these London hospitals. Your chances are, quite high, depending on whether or not they have the need. If you're a GI radiologist, for example, if the hospital doesn't need a GI radiologist and their team's overstaffed, then, the chances are low. But there'll be a hospital in London that will need a GI radiologist, for example.
Okay. There is one question in the chat. Jack, would you mind answering?
I see that about a rental crisis in Ireland. So that I would imagine is Ireland. We only work with Northern Ireland because that's still part of the official UK. Northern Ireland's fine. There's no issues there. I recently assisted a doctor who he joined a job in the NHS initially 2 years ago. He worked at University Hospitals Birmingham. He then decided he wanted to go to Northern Ireland to try something slightly different and be in a different part of the UK. We assisted him in that, and he's had a very good experience with Northern Ireland so far. So it's a good location to relocate to.
And one more question, Jack, if I have done my subspecialty training in breast radiology, or say I have done in intervention or neuroradiology. So if I decide to work as a locum consultant, will I be supervised? Means for initial couple of months, I feel that it should be good that my work and my report should be supervised by some of the senior consultant instead of just directly dispatching it.
Absolutely, yeah. So when you come to the UK, they're not expecting you to go straight into the deep end. They will assist you and supervise you and give you advice and guidance in your reporting for as long as you need it in most instances. Once you're comfortable doing your reporting independently and you're happy with the standards of your reporting, if the lead consultant's happy to do so and you're happy to do so, that's fine. If you're not ready, then they're happy to give you that supervision.
Okay. One last question. You said that the hospital will do a job interview. So that job interview will be, you said it is like more of informal chat rather than formal chat. So in that job interview, do they ask some academic questions or it is purely informal? Means what do you want to do? What is?
Every hospital does do it slightly differently. What we do find is most hospitals, I'd say 75% of hospitals, they will have an informal call with you initially. So the informal call is ultimately just a really brief 15 to 20-minute conversation with you to discuss your experience, the experience that you've gained in your residency, your FRCR, post-FRCR, the work you're doing at the moment. And then the lead consultant will just let you know about what the department needs and what they're currently looking for. If you both think it's a fit from there, then they will proceed in doing a formal interview. Now, the formal interview, we have preparation materials that I can send over to you. We have quite a good worded email that we can send that just confirms the structure typically of what the interview will be. They'll ask you clinical scenarios. They'll ask you maybe some reporting questions and also ethical questions on the way that, things are conducted in hospitals. So this is all stuff that we can prepare you for at the right time.
So I guess Dr. Bharat, Jack has helped us to solve all our queries. So if you guys have any queries, you can always ask in the group. He's a part of our group. He will be more than happy to help you. And also this session will get uploaded on our YouTube channel, so you can go through it. If few people have asked me before starting this webinar whether this will be available on YouTube, because they are not able to attend it today. So obviously we'll upload the session on the YouTube, and then people will have benefit to it, and people can always contact you. Jack, thank you for taking out your time, and thank you for describing each and every step in such a detailed manner. Thank you, Dr. Bharat. I appreciate your efforts. Even after being not healthy 100%, you decided to volunteer yourself and do this thing. So if you have any doubts, our audience, you can always ask in our Telegram group, and then we all of us are there to help you. Jack, I'm looking forward to receive your salary scale, then CV template, and in the last you also said one more thing.
Yeah, thank you for your time today, everybody. It's been a pleasure. Any further questions are welcomed. I'm more than happy to assist in any situation. If you're ready to come to the UK now, then great. Let's get you moving. If you're not quite ready yet, but want to have a chat about what we can offer you in the terms of the jobs that we have available, let me know. If there's anything that you need to know, I'm here always. So just drop a message in the Telegram group, and I'll get in touch.
Thank you, Jack. Thank you, Dr. Bharat. We'll conclude the session today, and see you next Friday. Thank you, guys.
Bye. Thank you. Bye.
Thank you, Dr. Vaiibhav. Thank you, Mr. Jack.